Hello and good evening. Thank you so much for coming. And today's gonna be a good day. It looks like everything is working today. So we are going to have this lecture. Good evening, all. Good evening.
Good evening.
It looks like we are gonna have this lecture today, oh, by fire, by force. I'm so sorry. I want to once again apologize to, especially for the people that showed up last week. And for some weird reason, the Zoom just wasn't working. So because of that, we just managed our lives and we had to postpone and push it to today. So we are going to get it done. Thank you so much for spending your time with me every single Wednesday evening. I pray it will be a value added opportunity this night. I come from my
Daddy,
heart.
did you lock the gate for the night?
Yes, they locked the gate for the night. I'm going to lock my gate also. Hold on one second. Hang on. Okie dokie. Let me just put this on the stand. All right, I am the most informal person you'll ever meet. So I don't know why, but nothing is too serious. Okay, only thing serious is to be healthy. All right, so once again, good evening, and thank you so much for showing up again and trusting me with a big topic like this. Last week, as I started to say, we started our lecture, and for some weird reason,
Ah,
I
she
think
really made up.
I did not make up. I did
Dr.
not make up.
Susan.
This is how I was born.
So you can
Okay,
hear me. You are
of
looking
course.
beautiful. You can hear, you are looking very beautiful this night.
You know what? It's for you. It's for you. I'm
We love
celebrating.
it. We love it, Dr. Susan. We
I,
love
we-
it.
thank you. I'm celebrating health and I'm celebrating you.
We
So
thank God. We thank God for your life.
thank you so much. Thank you. Alrighty. So I'm gonna mute. Okay. So once again, welcome. I've said that welcome like 3 times, and I will continue to say welcome and thank you for coming to this lecture. So I'm muting all again to try to get off the background noise. Okay, so today we are going to take a big topic, and the topic is on disease, and not just disease, but how does disease enter the body in the first place? Number one. And then, if we know how disease gets into the body in the first place, we are going to now be armed with how to block it at the gate. Okay, so once again, we are going to talk about how does disease enter the body, okay? And then we are also going to talk about how we are going to block it. Okay, so I just pray that you have as much fun listening as I had so much fun preparing the lecture. I also want to say that a lot of what I have written, I just sat down and I prayed and I said, Heavenly Father, everybody who's going to spend their hour that they will never ever be able to get back, they want that secret code. They want to know, what do I have to do to never get sick again? They believe in the concept of a sickness-free body. They believe that you did not make this body to be a dwelling place of diseases. So I now ask God that please, guide my mouth, speak to your people. So in the process of just praying, I made some notes. And then I realized after making the notes that the note does not exactly rhyme with my slides. So it might be a little bit like I might say more than what's on the slide or a little bit less. But I think the most important thing is that you understand just 2 things, if not 3.
It's food.
What are
Food
some
we
of the
want.
ways that disease make it into your body, especially
What
when
she
you're
wants
not
is
looking
food.
and when you don't know? And then the second one is, how do we block it? So that's why we are here. So for those of you who don't know me, because I found out that every single class we have new people joining. So I want to use this opportunity to welcome all the new persons that have joined us today. We found out people are joining this lecture from South Africa. They're joining from Canada. They're joining from Umuahia. They're joining from Lagos, joining from Abuja. In my mind, we are just mostly from Abuja, a little bit from Lagos. I did not know that people are joining from out of country. So even though I will still stick with the Nigerian examples because these are the examples that I know. And then whenever possible, I will also use global example because I found out that outside people outside of Nigeria, they've started joining our health talk. So that being said, so for those of you who don't know me, my name is Dr. Susanna. My core passion is in keeping the body healthy. I personally believe in a sickness-free body, and I also believe in a sickness-free world. And I know that it is possible. I'm very big on preventive medicine. I have a master's of in preventive and promotional medicine. And then, but before then, I started my whole career from core pharmacy. That is, I have a doctor of pharmacy. I know everything about how to use the drugs to correct the body, but I found out that it's not enough because I was in a certain challenge some 20 years ago in my life, and just the drugs didn't do it. And that's when I prayed to God that what else is out there to heal the body. And when God answered, I now made a promise that whatever it is that I've learned, I will take it to the world. And what did I learn? I learned that outside of living your life so that you end up being 100% drug dependent, there's so much more that we can do or can contribute to healthcare so that we don't even end up on drugs in the first place. And then even if we end up on drugs, just a little, because as I always say, there will ever be need for hospitals, doctors, pharmacies, there will ever be need, but we must not live our life so that we just do nothing and wait to get admission, surgery, all that lifelong diseases. So that's why we are here. So today's topic is on having a disease-free body. And so I'm going to go to that lecture slide now, and then we will take it from there. Oh, just before I go to the slide. So there's a man who was on CNN, BBC, all over the world and internet, and he spends $2 million every year to live to be 1,000 years old or not even die. His name is John. I know I memorized the John part. I can drop the full name later. And there's this whole concept that is starting to come out in the US, and he has a lot of followers that they believe that they will not even be able to die. So this man is actually 47 years old, and he's able to test his organs, cells, lungs. Like his lung is a lung of an 18-year-old. Most of his organs are between 18 and 20-year-old. His skin, it's like the skin of a 19-year-old and everything. So the difference between us, which are doing it naturally and not testing, and him is that he's doing it and he's testing. And why did I even bring that up? I want to let you know that for every effort that you make, maybe you don't have an equipment to measure it. I want you to know that it counts. Because when I went through all that he does, I now realize that we too, we are really, really trying. So that exists. So this whole project, Immortality, is already starting to brew. But let me bring you back to what we believe in Dr. Physic. What we believe is that God has set your exit date and nobody can change it. So if God says you go out at 100, it's 100. If it's 50, it's 50. But you must not go out from a wheelchair. And I did a presentation for 80-year-olds and above, and there were about 30 something of them. They were all 80-year-olds and above. And during that presentation, every single one of them said one thing in common. And that one thing in common was simply that they don't want to end up being a burden to somebody when they're older. So they say, Dr. Susan, I don't mind living long, but I don't want to be a burden to myself. I don't want to be a burden to my family. I don't want to be a burden in a way that I can live long, then someone has to wipe my bum bum when I go to toilet and all of that. So didn't want to be a burden. And why did I bring that topic up? I brought it up because all of this effort, all of this lecture, it's all about making sure that this earth jacket, what is called the body, it stays as healthy as possible. But the date God has determined that we will exit, we believe that that's the day we will exit, even though that project, immortality stuff, has started gaining momentum in the US. So I thought you should also know current affairs, what is out there, and how people are starting to think now. So that is that. Okay, so I'm now going to share my slides. Start. Okay. Hang on. Okay. Okay, so here we go. So today's topic is degenesis, and degenesis is all about know how disease enters your body in the first place and how to block it. So that is what we are here to do today. Now, the objective of this presentation is to understand diseases, how it enters the body, and steps to prevent and block it. So that's what we are here to do. And I believe we will be able to achieve that goal, the objective. So let's discuss a bit. Degenesis, what is that? We know that Genesis stands for beginning, D for disease. So this is all about the origin of disease. Where did it come from? That is one. Two, I want you to have it in mind that it's not when you have a symptom, for example, the headache, the stomach pain, the BP going up, the increase in sugar. It's not when you have, even if you don't remember anything else from this lecture, it's not at that point where you have a symptom, it's not at that point that disease entered your body. So many diseases entered your body 3 years before then, 5. I'm not talking of infectious disease now. I'm talking about in general. So infectious disease can be instant. You shake somebody with coronavirus, you get it immediately, or you get it within the 7 days incubation period, etc. We are just talking in general. So, but what we want you to walk away with that by the time you see the symptom, that is not where you got the disease. You got it a long time ago. Colon cancer, for example, it stays in the GI tract, in the stomach, or in the colon for almost 10 years before you start seeing blood in your stool. And then when you see blood in your stool, you now run to
join program. When more to join?
hang on. You now run to I don't
know
know why I muted and it's unmuting. Okay. So by the time you have that symptom, say you have a spotting of blood when you're pooping, you now run to the doctor. When you run to the doctor at that point, oh God, I don't know why the interference will not stop. I'm really sorry. I still have to keep counseling. Mute all, yes, okay. All right. By the time you go to the doctor, you're reporting what? A symptom. You're reporting what? A symptom. Now, that colon cancer has been in your body 3 years, 5 years, sometimes up to 10 years before that symptom of spotting comes out. So this slide is just to let everybody listening here is that when you have a symptom, increase in BP, increase in sugar, spotting, frequently urinating, pain on your knee, pain on your back, ulcer, headache, whatever, that is called symptom. It shows up all of a sudden. But before it showed up, the thing has entered your body a long time ago. It says entry point where there was an imbalance. One, there was, it at the minimum level, at the entry level, something happened that your body experienced a certain imbalance. Then there was some kind of inflammation and maybe even a dysfunction first before you will ever get a symptom. So this our program is urging us to shift from waiting to see disease before we block it, and then moving towards blocking it in the first place before it starts. I hope I captured that well, because I've been trying to see, because if you get this slide very well, you've gotten it perfectly. So just remember that by the time you have any symptom, that disease has been there for days, weeks, months, years, up to 10 years before the first symptom will show up. So what really happened? What I'm saying on this slide is that something happened in your body that created an imbalance, inflammation, some kind of dysfunction before the symptom will eventually show up. So once you've understood that, the rest of the presentation will be move on very smoothly. Okay, so what is the genesis? As I said, it's about the beginning, okay? The root cause. The root cause, how did it start in the first place? What brought about it? Honestly, I've not had this much interference, and I personally believe it's because of the amount of people on the line, or maybe when somebody joined. So bear with me. Okay, so what I was trying to say is that disease, today we are going to focus on the root cause of disease, not the symptom. And then so that you know the entry point and stop it before it starts keeping you permanently sick. All right, so let's do a little bit of definition. So this is how I want you to remember the definition of disease for the rest of your life, if you want to really get this thing very well. Are you ready? Okay, since you're ready, I'm ready. Disease, you divide it into two. D-I-S, dis, E-A-S-E, ease. So if you spell disease like this, you can see it's D-I-S, dis, then ease. It means there was some kind of an ease somewhere, because God has created your body so that it will have the ease to function optimally. So it can have the ease to do all that you were supposed to do on earth. So your body was supposed to function with what? Ease. The body is a very complex machine, but for some reason, God created it so that it functions with ease. You can pick up a glass of water and drink with ease. But if you're paralyzed from stroke, you'll be shaking your hand, and by the time or maybe Parkinson's or whatever, by the time you carry the water to your mouth, your hand is shaking and you spill it all over yourself. So there's this ease. What does that mean? It means that there was an ease. Now, this means the opposite of good. The opposite side has entered. So look at this, okay? It says disease is divided into two words, dis and ease. So when the body is at ease, the body is free to perform and function optimally, relax, and even remain happy. Once the ease is altered, remember we are talking about how did we get sick in the first place. Once that ease is altered or challenged, then there is disease. And disease in the body will lead to you not feeling well. So this ease suggests a lack of ease or comfort to your normal state of well-being. So it means that you're not well. So all diseases can be tracked back to disruption, especially at the cellular level, and there will be some kind of a cellular energy disruption or cellular function. So every single disease, for the most part, and I will go through them one by one. So I hope you understand this slide very well. To drive it home, the root cause, this is
No audio, ma'am.
We can't hear you again, ma'am. No audio, we can't hear you.
Ike yata na zubar da komi ya taba ta yi min komi ba. To, in ce mishi ya sa ruwa a kai.
None of us can hear again. Or what's happening?
She's even disconnected. The host is disconnected.
Maybe it's network. Maybe our network. Maybe the Kiritan going.
Now let's hold on a bit and see if she can reconnect back, and then we continue. I hope so.
Hear us.
It says I am muted. I don't want to be muted.
Your voice is being heard now, ma.
Okay, thank you so much. I'm not sure why that happened. Okay. Alrighty. So that is that. Okay, so last week there was a man who ran straight from a hospital to our clinic. And what happened to the man? He was spotting. It happens to almost all our clients when they come to report this colon cancer. He was spotting, just seeing blood in his stool. And he ignored it. And then finally he told the doctor friend, and the doctor friend said, let's look at your colon. And he tried to do digital examination where he put hand, and nothing was found. He decides to do endoscopy. And in the colonoscopy. In the process of doing colonoscopy, they found a tumor. And his life, in fact, according to him, his life is over. And I said, okay, your life is not over. As long as you've stepped your foot inside this Dr. Physic, by God's grace, we will go the journey of wellness with you, even though we may do it, side by side with the hospital, because they've already caught something and you still have to follow the doctor and everything. Anyway, make a long story short, I'm bringing that example to share with you that colon cancer and that spotting, it did not happen at that time. I have another lady who she's a friend to a reverend sister, and they grew up together and everything. Actually, I have maybe up to 2 people like that, but she's a friend to a nun, and this reverend sister developed a cancer, and it was actually a breast cancer. And this woman nursed this sister as a friend until eventually the sister died of the breast cancer. So this woman believed that breast cancer can kill, and that thing was inside her body, that breast cancer can kill. Guess what? 3 years down the line, she's standing in front of a mirror and she looks down and she sees a lump, and then she runs to the hospital, and they didn't even need to tell her it was a breast cancer. Now, I personally believe, I'm sorry to say this, but I hope she can make it, because I don't believe she has, because I know her, I don't believe she has what it takes to survive that breast cancer, except she will change her mind and know that breast cancer can be conquered. Now, all of that time, toxic time in her life where she was in and out of the hospital, crying with a friend and all of that, it messes up your body. So I'm using this to let you know that there are some toxic situations that we find ourselves in, a situation that maybe we cannot forgive somebody, a situation that maybe we cannot get out of that situation, and we stay in that situation. I want to tell you that is one of the biggest ways disease enters the body. So when you stay in an emotionally traumatized situation, maybe your wife did you wrong, your husband did you wrong, your children did you wrong, somebody died. Like I know somebody, the husband died, and they will not allow her to bury the husband unless she says all of the property. They dealt with her mercilessly and all of that. This situation, when you find yourself in that pocket of situation, maybe you were supposed to have a promotion, they did not give you that promotion at work, maybe, just maybe, there's none of us that don't have situations in our body. You will not find it in normal medical textbook, but I am here to let you know that based on my experience in the lifestyle medicine clinic, I found out that this is when you have given your body the manure for everything to fertilize, the fertilizer for everything to boom in sickness. So even if you had small cancer cells or oncocells, that toxic, stressful situation, it becomes like a manure for that thing to grow. Even if you already had small ulcer, when you're stressed and stay in that toxic situation, it becomes like a manure for that to grow. If you already had a tendency for BP, blood pressure, there's a certain stressful or toxic situation that will come and you stay tight, vasoconstricted and everything, the BP will come. If you had a tendency to have a sugar issue like diabetes and all of that, a stressful situation shows up and you stay long enough in that situation with high levels of cortisol and all of that in your body, that this thing will come, sickness will come. So remember, our topic is how does disease enter your body? I'm just giving you some examples that may not be too obvious to you, that are 100% certain of how, that I am 100% certain of how diseases enter your body and actually get big in the body. Another thing is that, so I was talking about the heart. So the heart, for those of you that have BP problem or heard about BP problem, how did it enter? It could just be that maybe you took a little bit excess of salt, a little less sleep, and all of that. Before you know it, the BP will just start small. And before you know it, depends on who you meet. If you meet a doctor, the doctor will say, oh, you know what? We have to start you on BP drugs immediately. The doctor does not know better. But then, of course, if you meet someone like Dr. Susan, I'm like, okay, you know what? Let's try sleeping properly for 3 days. The thing doesn't go down. Let's try losing weight. Obviously, if you come with hypertensive emergency or urgency, we have to medically crash it and then start talking about all these lifestyle modification things. So disease enter the body from several, several ways. It can enter the body, like I said, size. If you're oversized or undersized, disease can enter the body. Okay. Now, remember, I've mentioned from the cells, the blood, the neurons, the hormone, the this, the that. But all of this, no matter what, the cells and tissues around that area will have a lot of issues. So depending on the area of the body, it will lead to inflammation or immune response, okay? And then once that starts happening, you will have a symptom. And then once you have a symptom, this is when you now run to the doctor that, oh, I'm not feeling fine. It means you've been diseased. Remember, diseased. All right. So the issue is that we do have over 70% control of getting rid of, actually the solution, or the good news, let me say, is that out of 10 things that make us to be sick, 7 of them we have control over. So that is the good news. And I'm gonna move into that place in a very short time. Okay. So now that I've described that, I now want to wrap that slide up like this. One, we are sitting here, you're like, okay, it can affect your cell, your blood, how does it really happen? Number one, it can come from lack. Like I said, lack of sleep. If you don't sleep, you will pay. Okay, the interference continues. Mute all. Okay. Okay, it can come from lack. It can come from excess. So what is the example of lack? Lack of sleep. Okay, it can come from excess. Excess what? Excess salt, excess sugar, excess anything, even excess healthy food. Because I keep talking about I have a book. It's because God has given me more than 60 books that I'm supposed to write to save humanity from being sick in the first place. And one of the books is titled Healthy Food Kills Too. So if you overeat your olive oil, overeat your healthy food, you're still gonna get a sickness from it by overeating healthy food. Food must be eaten in moderation. And anytime you take your hand to your mouth, ask, is this healing me or is this killing me? Disease can enter your body from toxins. Okay, what is toxin? You spray insecticide in your room, you now enter and you stay there. That's not good. You stay in the room all day, you don't step out and see the sunlight and come back. You know, if there's toxins in the room, it will catch you. There are other toxins that can actually also enter your body. A mosquito bite, it puts a malaria in your body, is a toxin. So if we block those toxins in the first place, we will not get a sickness. It can come from germs. The picture says it best. If you don't wash your hand and then you're not clean, you can get a disease from germ. What of genetics, genetic disposition? If you, maybe if your mother and father had this and that, you're supposed to do. But with genetics, science is showing that we can beat that DNA, we can beat the code. How? If your mom had diabetes, like my mom did, and your father had hypertension, like my father did, the best thing for you to do is to make sure that you exercise, you eat right, and every single thing, and you will not get it. So many children have escaped the disease of the parent because they altered their very lifestyle. Okay. I also said something about the disease can enter your body from your mind. So I will come back to it. So I've explained how disease can enter from the organ, that is cell, tissue, organ, GI tract, neuron, heart failure, oversized cells, tissue, blood, you know, like the blood, fat, you know, like cholesterol and all of that can actually, you know, it's still in the blood. So when I say cholesterol, like if you have too much fat all over your body and is blocking the blood flow from getting to the brain, it will not be too long. You can get a stroke or you will not have enough blood in your heart to pump and something can happen to somebody. So diseases come from many, many places. This one, I got it from WHO, and I've already covered it, you know, lifestyle, genetics, and even the healthcare. So I'm going to leave that. Now, I've just finished explaining that disease can enter your body from lack of sleep. Look at this one. Lack of micro and micronutrients. Let me explain. In Nigeria, we are very I don't even know which language to use for us, but we are not nutrient conscious. That is the best word. We are not nutrient conscious. How do I know this? Every patient that comes to Dr. Fizi, we do a test. It's called CLA, Comprehensive Lifestyle Analysis. And we found out that they're not nutrient conscious, number one. They eat when they want, number two. I'm not a breakfast person, but I ate breakfast yesterday. I'm not even a dinner person, but I ate last night. That is how we are behaving on this side of the world. And that is very detrimental to the health. One. Two, in our country, we are very, we are always in carbohydrate and oil. And we know that the leading cause of all the chronic diseases is too much carbohydrate and oil. Banana and groundnut, carbohydrate and oil. Bread and butter, carbohydrate and oil. Rice and stew, carbohydrate and oil. Starch and banga, carbohydrate and oil. Even yam and palm oil is still carbohydrate and oil. We are not macronutrient conscious. That means, where's the protein? So, and you notice that in the first world, they will ask you chicken, fish, or beef, then one should pick. They will now ask you for side order. But if you go to a Nigerian restaurant, the first thing they ask you, we have semo, gari, rice. We name the food by the carbohydrates. They name the food by protein. So we need to be more macronutrient conscious, especially protein conscious. So if you lack a macronutrient such as protein, you're going to age like a frail elderly. You age, but you'll be weak and you will not look good. I met a lady yesterday in our clinic that says, Dr. Susan, I don't want to live beyond 50 years old. I'm almost sure she's on this line, so don't finish me, because I said I will expose you. She said, I don't want to live beyond 50 years old. So maybe because of her image of what it looks like beyond 50 and 100, some people, they don't want to live beyond because of how frail and, and all of that. So there are many reasons why she doesn't want to live beyond 50. And I told her, this is why God made you to miss your steps and enter a longevity center, because you're going to live to be 150, God, if God permits, but that 50 is not on our agenda. So we have to be both micronutrient and macronutrient conscious. Inadequate sleep. That man that I told you that pays 2 million, in the beginning, I told you about a man who's going to live to about 1,000 years old. Is a project in America now. And we asked, some people ask him, what is the number one thing that resets the biological clock? He says, even if you did nothing else, sleep. Inadequate sleep. So we found out that sleep is like taking 50% of everything that we need to do to live healthy. And yet Satan does not allow us to sleep. Why? It's on this phone, you'll be going to Instagram, news, this. Drop the phone and sleep. Drop the phone and sleep and live long. So there's a lot of clinical studies that showing that sleep, we not sleeping properly, is the leading cause of us not being healthy. Let me make sure that you people are still seeing my slides. Please, are you still seeing my slide?
No, ma.
So someone should have said something now.
It was
Okay.
written, they sent a message, maybe you didn't see it.
I didn't see you, but at least I think I'm even explaining well. So maybe that's why you people have not finished me yet. It's okay. I will adjust. I think that time I was kicked out. It's when the screen also disappeared. Please, I'm sincerely sorry. Okay, I think you should be seeing the screen now. Okay, perfect. All right. Lack of oxygen also contributes, okay? Toxins. For example, you don't light cigarette today and get cancer tomorrow, but eventually it will come. But there are some people that, I don't know how it happens. 90% of us, is this what is, they're just that 10%. I want this to be captured very well. There is just that 10% of people that no matter what they do, this thing does not apply to them. So I'm actually talking to the majority of us, the normally built people by God directly, because there are people that they take 16 cubes of sugar, diabetes did not enter. You know them. They eat starch every night before they go to bed. So, but you try it and then see what happens. So one of the things we teach is that listen to your body, and your body will tell you what it wants, what it can handle, and what it cannot handle. So the last three things I want to stress on: how disease enter your body, and then we now conclude with the solution is your mind. I gave one example earlier about the woman who is a friend to a reverend sister, and she has a breast cancer. I have too many examples like that, where if you believe last week, one of our clients called me back and told me that his friend, I believe that's what he said, his friend was crippled, like he couldn't walk when he was a kid. And the mother believed that this boy will walk and took the boy at a birthday party, took this boy and put the boy in the midst of small boys that were running. And this boy looked at them and did not even know when he stood up. And then he's now walking, and he's walking till today. True story. Your mind can heal you. Your mind can kill you. In the book, Everything Heals, that I personally authored, there's a chapter there on your mind as medicine. But I also let you know that your mind is not only a form of medicine, your mind is also a form of poison. Everything you think, you secrete. Everything you think, you secrete. You think happiness, you secrete happiness hormones, disease will run away from your body. You think negative, you secrete negative hormones, sickness will stay in the body. Think about it. I hope only adults are here. If you think about sex, maybe naked body or whatever, for a very, very long time, and you're gonna get erection. So that's to show you, and if you can even get ejaculation, that means that you can think and secrete. That is sexual. Now, if you're thinking about a very sad situation that happened in your life, you're sitting there, nothing, no, tears will just rush down your eyes. You will just start crying. Guess what? So this is my simple example to show you that anytime you think and hold on to a thought for more than 120 seconds, assuming it is a negative thought, you will secrete sickness things in your body. So guide your mind. One of the lecture is going to talk about how to block it. Block this sickness from your mind. Block it from your mind. So know that your very mind is the leader in bringing sickness into your body. Some people say, oh, I am a BP person. If you personalize that you're a BP person, it will never go. You can now just say something like, oh, the BP, talk about it detached. Okay, so your mind is another place. Remember, the lecture is no secret places that disease can use style and enter your body. If you came here to hear that is about germs, sorry, I disappointed you. But from my practice, for like 20 years now, I have found out that disease is entering the body from every place except where the core medical book is presenting to you. And I said, I am going to expose it. Now, obviously, we know the obvious. You drink alcohol small. If you were supposed to lose 50 billion cells, you lose 100 billion cells, you lose 150. Who is going to die faster? Is you. Okay. Now, I'm not saying you should not drink alcohol. You drink alcohol, maybe you dilute it with water, but I just want you to know the truth so that even if you drink alcohol, you now know that, okay, you know what? This alcohol is not perfect for me. I cannot, but just that consciousness. I did say Nigeria, too much carbohydrate and too much oil. Then lack of ease is stress. That is the ultimate. Remember, the definition of disease for this lecture is what? This is the body is supposed to be at ease. The cells are supposed to be at ease. The blood is supposed to be at ease. The neurons at ease. Your physique at ease. Everything is supposed to be at ease. But what happened? This, which is the opposite, has entered. And we did say that it starts small, until it gets to tissue and organ level. You may not even have a symptom to run to your doctor. And by the time it gets to the organ level, you run to organic doctors. So if it entered the heart, you go to the organ cardiologist. If it has finished your kidney, you go to who? Nephrologist. If it has entered your, vaginal area, private part, you go to either a gynecologist or a urologist. If it enters your intestine or liver between your mouth, you go to who? A gastroenterologist. We are saying that you must not wait to get to the organ specific doctors. You can start something ahead of time. So here's the way forward. Number one, these are the ways to block it from having. You can just do something as simple as keep a score. Ask yourself, on a scale of 1 to 10, how am I doing with this? On a scale of 1 to 10, how am I doing with this? One thing you can use that our ReOwned formula. You know, Dr. Physique has a formula called ReOwned that talks about rest. On a scale of 1 to 10, how did I rest yesterday? Is it 10 over 10? If it is 5 over 10, know that you've not blocked that disease from sleep that day, okay? Water as medicine. Did I have enough water? I did not have. Put it now 5 over 5. If you keep scoring yourself, you can now wake up and now do something about it. Pay attention to your system. Follow the Dr. Physique pillar of longevity, which I will quickly flash here and end. And then stand at the gate of your health, not your healthy. Stand at the gate of your health. Do regular comprehensive tests, because you know what? Once you have the symptom, it's too late. Symptoms means it is strong enough for you to be on lifelong drugs, surgery, admission, and maybe death. So if you now join us on this our sickness-free body wellness platform of Dr. Physique to say, okay, you know what, Dr. Susan, here and there, keep coming to the lecture. It's not only when we talk about that, we are going to talk about disease how to block, because we cannot finish everything in 1 hour. Tomorrow we can talk about how to use water to kill everything, talk about how to use food. Even my next lecture could even be on your mind as medicine, like that. We just keep going small, small, small. Before you know it, over time, you have gotten everything and you find out that you're now very healthy. Control your mind and pay attention to your health habits. So this is the ReOwned formula that you should use on daily basis. Score yourself. You can even try now. Score yourself. Only today is Wednesday. Yesterday, in terms of rest and sleep, score yourself right now. We are doing it together. Let me get my own pen. Yesterday, for rest, did you score 10 over 10? Did you rest properly? I know you scored 10 over 10. Answer it to yourself. Energy level on Tuesday, from morning till night, maybe till, how was your energy level? Your emotional energy, spiritual level, did you score 10 over 10? Is you. Oxygen, did you even wait to do some deep breathing exercises? Did you exercise? Did you max out oxygen in your body? It's up to you. In terms of water, our formula is that you need 6 bottles of water before 6 p.m. And just to recognize that your body is like aquarium, the cells swim there. So any cell out of touch with water is a dead cell. Your 70% water, did you have adequate amount of water all of yesterday? Score yourself on a scale of 1 to 10. Did you score 7 over 10? Like that. Nutrition, did you have adequate protein? 0.8 grams per kg, or however, some people don't even know the protein formula for their body. If you reach out to our nutritionist, they can give you your own. Did you exercise? Score yourself on a scale of 1 to 10. If you exercise yesterday, then you score 10 over. If you keep that score small, 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 it's you that will call yourself and tell yourself what to do. Lastly, detoxification. Did you detox? We believe in fasting once a week in Dr. Physique as our lifestyle formula. Once a week you fast and then you break it with something green or vegetables and fruit. You don't eat any cooked food that day. Just once a week. It's mandatory for every Dr. Physique person to do that to have health. Okay. Alrighty. Let me see. So I've talked about all of this, approaching rest as medicine. The number one biohack, it's called biohacking, is sleep. And if you're not sleeping, you will have your life. This is what the clinical studies is showing, that sleep is almost more important. In fact, sleep is more important than eating, because fasting has become a medicine. We talk about the energy, the cellular energy. We talk about deep breathing exercise, maxing out oxygen on your body. We talked about nutrition. We ask that you become more macro. Let me talk about exercise. When you're a kid, you're always running up and down, but when you're older, you just stay in one place. When you're dead, you're stiff, you don't even move. So if you're not moving, you're closer to exit. So just remember that. We have detoxification. For me, no detoxification is better than colon detox, because the colon, once your colon is clean, your whole system is clean. As most of you that come to Dr. Physic, you know that if you do the colonic hydrotherapy, the sugar start coming down, fats coming down, stomach deflates and everything. That is one detox. The second one is fasting. The third one is drinking water and then going green. So there are many ways. We will do separate lecture on detoxification. So all the pillars, I've talked about your mind as medicine. So this is the concluding slide. In Dr. Physic clinic, this is our formula for wellness. Today we talked in general about diseases. I know that even if you did not remember anything, you know the meaning of disease. What entered your body to make it diseased? Was it a virus? Was it a bacteria? Was it lack of something? Was it excess of something? Was it lack of something? Was it lack of sleep? Whatever. Something enters and it causes a disease, an imbalance at cellular, blood, and all that level. So, fine. Where is the solution? This is the solution. Okay, the solution is that naturally, of course, if water don't pass Gary, you have to go to doctor for surgery, admission, and lifelong drugs. But even at that, you can still slowly start repairing your body, slowly, until by God's grace, the drugs will fall off. So in conclusion, healing is not a destination. It's actually a return to balance, okay? It's a return to balance. Pay attention to your system. If you see, feel something, no matter how minor, you just have to run to the doctor. You are the gatekeeper. And how do you keep the gate? Go do labs a lot. Don't ignore anything. Don't ignore anything, okay? Protect your wellness like royalty. A sickness-free body is actually very possible. So once again, thank you so much for your time. I know it was a long and a very big lecture, and I'm sure by God's grace, if not for anything, you should have a new way of looking at your body, your system, and then start paying attention to imbalance. And just before I take a couple of questions, I want to say this. For those of you who joined very, very late, I want you to take, God bless you too. I want you to know this. Number one, what I have taught you now today, outrightly is not in any, it's not that you have to practice, search and research before you can capture it this way. It's not presented. Go on the internet, put how does disease enter your body. You see James' theory. You see communicable disease and non-communicable disease and all of that. You're busy with big words. Meanwhile, just your mind has taken you there. You understand, etc. So this is what I want you to go home with today. Number one, know that This is when it starts, you will not feel it. And by the time you feel it, it's called symptoms. So just pay attention. If something starts coming small, number 2, don't ignore it. Because when you ignore it, it becomes a problem. Number 3, don't mask it with drugs. Don't mask it with drugs. What do I mean by don't mask it with drugs? You have a headache, you know what? You take paracetamol. In fact, there's a commercial I saw that you should be carrying paracetamol. You keep masking it, and one day the paracetamol will not work, and you will fall down. Okay? God forbid, not anybody on this platform. Follow the pillars of longevity as we presented. Stand at the gate, do your test. Last week, a man in Lagos, I think everybody should have seen it, it's viral now. He was celebrating the wife's 60th birthday. He presented a brand new SUV, and while standing on the stage, dancing and lifting the hand up, he called the wife, "Give me small water to drink." Before the water will come, he fell down and he died. So imagine that somebody can be on the stage dancing, and on the stage, or you fall down and die. So you can see how much our body can endure before it takes you out. So please, if you have not done your annual comprehensive test, do it 2 times a year. Nobody is doing once a year again. That is number 1. I don't want, in my dream is all the hospital beds should be empty, except there's a real reason. So let us not live our life deliberately to go and move into the hospital. Let us live our life so that way we have more respect and regard for nurses and doctors, that when they are truly needed, they are there and we can use them the right way. So thank you so much for your time. I'm screaming like this because I don't want to see anybody sick. So thank you so much for your time. I'm done. I hope it helped. I will take 1 or 2 questions, comment, and then we will go from there. Thank you. Is anybody out there?
Yes, we are.
Yeah.
Okay, thank you so much. All right. All right, it says, God lavish you, amen. Can we get the slide? Yes. Thank you, Dr. Susan. God bless you. 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 Let me see. Can we get the slide? What is special about alkaline water? That's a question. Alkaline water has been, let me say, clinically proven to, I mean, there's no serious clinical trial, but a lot of clinics have used it. And they have shown that when you drink alkaline water, we live in a very acidic environment. Meat is acidic. Soft drink is acidic. Everything is acidic. We are supposed to be somewhat alkaline. So some people, and God brought water that is more alkaline, and everybody, all the studies and everybody that is into alkaline for treatment shows that when your body is more alkaline, cancer cannot grow very well. You cannot have ulcer. You cannot, it's hard for you to have a disease when you have an alkaline body. So a lot of people drink alkaline water to try to decrease the effect of acidity in the body so that they can have a sickness-free body. So that's what's special about alkaline water. Thank you. So do I have any question, comment? Did you understand the lecture? I would like to have a feedback, please.
Good evening, Dr. Susan. My name is Mercy. Thank you for the wonderful presentation.
Thank you, ma'am.
Despite the network glitches, for the explanations you gave were very detailed and good. Thank you so much. So my question is, you also mentioned what I was going to ask, so I'm going to ask it. You talked about people having twisted intestine and colon cancer. So a colleague of mine's aunt died 2 days ago as a result of twisted intestine. And according to her, she went for surgery and all whatnot, and of course she didn't recover from that and all. So my question is, what causes this twisted intestine, and does colonoscopy treat it? Should, in case someone else happens to have that in future, what are the best ways this can be attended to? Thank you.
Okay, thank you so much. Twisted intestine, first of all, it's not too common. And there are some things that happen in the medical world that, in fact, till now, it beats the medical system. Like, where does it come from? How does it come from? They don't know where it comes from. They call it idios. Don't worry about the medical term, but there are just some things that even in the medical books, medical school, they let you know that we don't know how it came about. This twisted intestine, it's one of those things that it's not so straightforward how it comes to. It could be a genetic defect, whereby, of course, you were born with something that predisposes you to. Think about it. You sit every day like a normal person. You eat every day like a normal person. Sure. Then all of a sudden, if they say your intestine is twisted, I mean, you only have one mouth. It goes down the right way. So that's one of those things that, I guess, in Dr. Physique, we believe that your exit date is your exit date. And there are some ways, some people will go out the way they're supposed to go out, and hopefully not in misery and pain. Twisted intestine does not have a direct cause, like, okay, because you ate too much sugar, or you ate too much salt, or you slept too long, or you this and that. It's not as direct. The other question is, can colonoscopy cure or treat it or whatever? What is colonoscopy? Colonoscopy just means the study of the colon, for oversimplifying. So there's this tube, and this tube has a camera on the top tip of it. And then they put the tube through your rectum, and the tube, after, we will give you what they call bowel prep. You drink a lot of water, and then your whole GI tract, especially your colon, will be clean. So we'll now use like a camera, just call it a torchlight, and go through the entire length of the colon to see if we will find things like polyps, cancer, or maybe some lesion. Some intestine, they gum together, gum with each other. Sometimes twisted intestine can come from intestine gumming together, etc. So it's not a treatment. It's actually more of an investigation type of tool, because we do it in Dr. Physique clinic. Colonoscopy outrightly cannot treat it, but it can actually go and try to find out what could have happened. Was there, maybe a gummy somewhere? Was there a lesion? Sometimes a lesion is maybe so bulky, it can drag the intestine in one direction, and then maybe can flip. There's so many reasons where that can come from. And may your friend's soul or rest in peace. Is unfortunate. You will not have a twisted intestine. I just always say, drink a lot of water and stay hydrated and make sure that you are okay. So sorry about that, but it's unfortunate, but that's my contribution to that question. Thank you. Okay,
Thank you.
so you're welcome, dear. Any other question, comment?
My hands is up, Doctor.
Okay, so please go on.
Okay, good evening, everyone. Good evening,
evening.
Doctor, for that presentation.
Thank you.
Yeah, the question I just want to ask is if you go through colonics,
Yes.
do you need to still go and do colonoscopy?
Okay.
Test?
First-
Because
okay.
it's always recommended that you do this once in 10 years when you are 50 and above. So I just want to find out about that. Thank you.
Okay. Thank you so much. So colonoscopy is recommended that you do once in 10 years if nothing was wrong with the past colonoscopy. But these days, they've actually changed the guidelines that they should do the colonoscopy once in 5 years because of how fast things that they did not see is showing up these days. So they've actually dropped to like every 5 years after the age of 50. Before it was 10 years. But with how cancer and everything is everywhere, they are recommending, especially if there's a family history, etc. Now, colonoscopy, which I just explained, is the study of the colon. Whether you're a teenager or 100 years old, you need to know about colonoscopy because one way or the other, you may run into it. So, like I said, this thing goes into as a camera. It studies the length of your colon to see if there's a disease. And you do it as often as you talked about, which I believe should be 5 years and not 10 years. 10 years is okay, but now they are reducing it to 5 years in most of the first world countries. Now, your question was colonics. Do you do this one and then do this one also? I want to let everybody know the difference between colonics and colonoscopy. Colonics means colon hydrotherapy. Colon hydrotherapy. It
I
means.
don't know if the network is from your end.
Okay, sir. Can you hear me now? Can you hear me?
We can hear you, Doctor.
Okay.
hear you.
Okay. So colonics means colon hydrotherapy. That means we use a small straw, we put it through your rectum, and we flush it with water. So basically, we are flushing your garbage.
Colonics is one we do now.
Yes.
I know.
So that's the colonics, okay? It's very, very different from colonoscopy. So doing colonics does not stop you from doing colonoscopy, and doing colonoscopy does not stop you from doing colonics. So there are two very separate things. One is just a study, just a diagnostic tool to see is there something wrong. The other one is more like a cleanser to clean you out. Now,
Exactly.
yes. So, but the other one is that you can actually do a colon hydrotherapy, and then after we finish cleaning your colon, then we can now use our colonoscopy tube to read your colon to see how clean it is. Is there any polyp?
Wow.
Is there this? Yes, sir. So our
What a big miss.
yeah, so our surgeon, if you don't want to go to the board, we can do colonics and then go and do the colonoscopy. But colonics and colonoscopy. And we also found out that people that are in the habits of doing colonics, which is colonic hydrotherapy, it's nearly impossible for you to ever get a colon cancer. In fact, one of our clients today came in with colon cancer. I don't know what is going on with colon cancer. There was another man I talked about who also came in with colon cancer. National Defense College, one man there, as he was retiring, because I teach the NDC when they bring in the new participant every year, generals, every year I teach them. One of them, as the person is finishing now, he went to hospital, they did a colonoscopy, found out he has a cancer. Before the program was finished, he was gone. But we found out that colon hydrotherapy, rinsing out your colon with just plain water, actually prevents colon cancer. So that's the relationship, amongst other things. Okay, somebody says—
Thank you so much.
You're welcome, dear. Someone says, doctor, what causes UTI? So what is UTI? UTI means urinary tract infection. Number one thing that causes UTI is your age. Once you're age 55, 65 and above, you're naturally prone to having UTI. Naturally prone. Why? For the women, your vaginal microbiomes, there are some things that God put around the vaginal area to be washing out your vaginal area naturally for you. Those things are dried up. And because of that, infection can stay because the good bacteria is all gone. So it's only bad bacteria that thrives. That's one. Two, dehydration. Then for the men, of course, with age, the prostate wants to enlarge a bit and it blocks a little bit of the bladder, and it can also lead to urinary tract infection. Another thing that causes urinary tract infection is sexually transmitted diseases. See, I'm so scared of STD to the point that, let me share what happened. We have a client who is trying to make a baby. So the person has low sperm count. And the person has been taking all kinds of supplements blindly. So we now took the sperm and then we did a test and find out that there's permanently infection inside the sperm. And the person has been on all kinds of antibiotics. So UTI, so if you have that kind of a man, which the person is looking very normal and everything, but the person has a small infection that is permanently dwelling inside, they can pass it on and it can still cause what? UTI. So UTI just stands for urinary tract, that place that urine comes out. If there's any kind of infection, so that is the meaning of what? Urinary tract infection, and it can come from a whole bunch of things, including even age-induced UTI. So that's what I can tell you. You say, what is the cause? Infection, age, hormonal imbalance, prostate issue, etc. Doctor, can you tell what to do when you suffer from constant catarrh? If you have constant catarrh, there's a high chance that your immune system is compromised. So you can raise your immune system to the highest level, and it will also help. You know what you can do? Go and buy probiotics and take it, because chances are you must have taken so much of antibiotics and then you've ruined all your good. You know, antibiotics that you take, it kills both the good and the bad bacteria. It's blind. So when you kill both the good and the bad bacteria, you need to replenish the good bacteria. Then you can be able to get yourself back. So you can meet me separately. I will see what I can do. Somebody says scripture actually teaches us that as a man thinketh in his heart, that is it. So you can think sickness into existence. Someone says, yesterday I feel my knees kind of disconnected and I lost balance. It happens occasionally when standing or walking. What could cause this and what is the solution? With age, there's something called the natural wear and tear on the body. But for me, if that happens, it could also be a neurological disorder. So you have to check two things. You have to check the physic, and then you also have to check the neurological, the neurons, because you should not just go out of balance like that. So something could be wrong with the joint, number one. The fluid in between the joint could be dried up. There could be nerve involvement, and then maybe the nerves is not connecting properly to your brain to help you to stand. So that needs a doctor's accurate diagnosis before we can start doing anything else. Doctor, can you please post the slide? Yes, I can, and I will. Lemon water and lime is very, very good. If you can have a lemon water and lime every morning when you wake up, it will also help you. It boosts your immune system, it rehydrates you. But of course, if you have ulcer, you take it and you listen to your body. As I said, this lecture is for that 80% of people, and not just people. If it doesn't work for you, then you don't take it. Glory, a lot of people are requesting for slides. Please give it to them. Yes, the lecture was straightforward, and oh my goodness, I'm even seeing people I've never seen on this lecture, like Elizabeth. Okay. Yesterday I feel my knees, that. Okay, so this is the longest lecture we have done, and we are going to pause it here. And before I pause, I want to send you home with this. Because you love health and because you're here, there's something called the law of attraction. What did I call it?
Law of
say the-
attraction.
Yes, the law of attraction. That
Law of
means that,
attraction.
yes, so it means that what you focus on expands. So so that means that you being here, you're beginning to, and your health, yes, law of attraction. That means what you focus on expands. And for the fact that you can invest this much time and energy in learning one or two things about the habit of health, how does this sickness even creep into the body, and even realizing this night that the smallest little thing that you do, like form the habit of every night you put a tablespoon of apple cider vinegar inside hot water as after eating and drink it, is a game changer. All the small things you do, it pays. 2, all the small things that you're doing, you are adding 5, 10, 20 extra additional years down the line, where when the people that did not get into the habits of health have started doing admissions and stuff, you'll still be kicking. Lastly, I pray a lot for you. Like, even when I was talking on this lecture, I just sat and I was just praying. I said, Heavenly Father, just that they would show up. Whatever it is that is in the pipeline, Heavenly Father, help me to wipe it off. And God answers all of my prayers. So I want to let you know that your effort is not in vain. These small things you have learned, understand it, know that this is just this is. And once the ease goes, you won't feel it that first time. But small, something small will come. You nip it in the bud as if there's no tomorrow. Do your healthy habits, try and sleep, do the longevity formula, and don't miss a wellness class if you can, and we will keep learning together. So I wish you well, sleep well, and thank you for coming, and God bless you. Have a good night.
Thank you, doctor, and good
All
night.
right, thank you so much. God bless you.